Hey everybody. So today I'm going to be talking about a specific pathogen, Mycoplasma pneumoniae. So what is it? It is a gram-negative bacteria that causes damage to the lining of the respiratory system. This includes the throat, lungs, and windpipe. This type of pathogen can be present in the nose or throat. Mycoplasma pneumoniae can cause pneumonia. So, how does it spread? It can spread through small respiratory droplets, such as a cough or sneeze. You breathe in the infected droplets, and the bacteria can potentially be present. It often spreads when living with someone else, living with someone infected, or spending a lot of time with a person who is infected, so crowded settings and family members. Um, some signs. So typically, mild symptoms will be present. It depends on the type of infection. In adults, it can be presented as chest cold symptoms, and children's symptoms can be presented a little bit differently. They can have more of cold-like symptoms. As mentioned in a published article by Sindir Kumar, Mycoplasma pneumoniae is identified to be responsible up to 40% of community-acquired pneumonia in children greater than 5 years of age. Symptoms can also show up 1 to 4 weeks after being infected. So, what are some symptoms? Um, in adults, it can be presented with a sore throat, feeling tired, fever, just chest cold symptoms. It can slowly worsen cough, headaches. In children, it'd be more cold-like symptoms. So the typical stuff: sneezing, stuffing, or runny nose, sore throat, watery eyes, stuff like that. However, it can worsen to pneumonia, which is a lung infection that can occur. And some symptoms of pneumonia can include fever, chills, cough, feeling tired, shortness of breath. Moving on to treatment. So what are some treatments? So usually you can recover without antibiotics. So over-the-counter medicines are used. However, if someone develops pneumonia, doctors usually prescribe antibiotics. There's several different types of antibiotics that can be prescribed to treat pneumonia. Um, However, there are some types that are resistant to the antibiotics. So we can see that patients will worsen before they can get better just because of that resistance to the antibiotics. And then also, um, there can be some severe complications that can occur. So such as serious pneumonia, asthma attacks, or new asthma symptoms, swelling of the brain, swelling of the brain, um, too few red blood cells. So this type of bacteria can be presented as a cold, but it can definitely worsen over time, especially if pneumonia is developed. So who are those who are more at risk? We see that it is commonly found in young adults and children in schools, and also in crowds. So, for instance, schools, college residencies, halls, military training facilities, long-term care facilities, hospitals is where most people are at risk for this type of pathogen. Also, people with serious infections are at risk. So, for instance, someone who's recovering from a respiratory illness or who has a weakened immune system. So, what are some ways to prevent it? As of now, there is no vaccine that is offered for this type of pathogen. So the only thing that can be used is the over-counter medications that doctors sometimes um, recommend, but overall it's just good hygiene. So when you sneeze or cough, cover your mouth and nose with a tissue, throwing away the tissue in the trash, washing your hands for 20 seconds, using hand sanitizer. um it's recommended to only take antibiotics when needed but overall, this was just some of the things about Mycoplasma pneumoniae. Here are my references. I used the CDC and a published article from Sindir Kumar. Um, And that's all I have for you guys today.